Greetings and welcome to week 5 of ME 180. Uh, this week we're going to cover vital signs and why we need to take them. Uh, First question, what are vitals? Or what we call them vitals. What are vital signs? Vital signs are what we use to measure the body's basic functions. Now, these measurements are taken to help assess the general physical health of a person. It gives us clues to possible diseases. It shows a progress toward recovery. Uh, Now, the normal ranges for a person's vital signs will vary with age, weight, and gender, and of course, their overall health. Uh, there are four main vital signs that we take. We take body temperature, we take blood pressure, we take pulse, which is your heart rate, and breathing rates. Now, the average body temperature is 98.6 degrees Fahrenheit, but normal temperature for a healthy person can range between 97.8 to 99.1. Some people have a slight subtemp, and some people will run their normal temperature will be slightly elevated. The body temperature is measured using a thermometer, which is inserted into the mouth, the anus, or placed under the armpit. Uh, it can also be measured by a special thermometer inserted into the ear canal. We call that a tympanic. Any temperature that is higher than a person's normal body temperature is considered a fever. A drop in the body temperature below 95 degrees Fahrenheit is defined as hypothermia. Now keep in mind that temperature can vary due to factors uh, other than illness or infection. Stress, for instance, dehydration, exercise, being in a hot or cold environment, drinking a hot or cold beverage, and thyroid disorders can influence body temperature. Because older adults uh, do not control body temperature as well as the younger adults, and older adults may be ill without ever displaying any signs of a fever. We also take blood pressure. Now, blood pressure is the measurement of the pressure of the force of the blood against the walls of your arteries. Blood pressure is written as two numbers, such as, for instance, 120 over 80 millimeters of mercury, or mmHg. The first number is called the systolic pressure and measures the pressure in the arteries when the heart beats and pushes the blood out to the body. Now, the second number is called the diastolic pressure and measures the pressure that in the arteries when the heart rests between the beats. So one is, excuse me, a pressure when it beats, and the other is the pressure when it rests. That just seconds that it rests between beats, not even a second actually. Now, the healthy blood pressure for an adult relaxed at rest is considered to be a reading less than 120 over 80 millimeters mercury. A systolic pressure of 120 to 139 or a diastolic pressure of 80 to 89 is considered pre-hypertension. And that sort of puts you, in other words, you're basically sitting right there on the fence. You could become hypertensive or not. And this really needs to be measured and monitored often. Now, hypertension or high blood pressure is considered to be a reading of 140 over 90 millimeters mercury or even higher. Blood pressure that remains high for an extended period of time can result in health issues such as atherosclerosis, heart attack, stroke, uh, things like that. Now, atherosclerosis, we also call hardening of the arteries, in case you didn't remember that from your medical terminology. Factors that can influence blood pressure readings are the following. If the person is under stress, that'll affect the blood pressure. It'll increase. Smoking, cold temperatures, exercise, having a full stomach, a full bladder, caffeine and alcohol consumption, uh, certain medications, gaining or losing weight, and of course salt intake. Excuse me. Now, if you're taking a blood pressure, beware of these factors when you're reading the measurements. If even if you're taking your own, so if you're taking your own, if someone else is taking your blood pressure, uh, be sure to tell them of any possible causes that you may have for high blood pressure, and know that blood pressure situations often or stations are often available for patients or anyone at drugstores and grocery stores. You can sit down and take your blood pressure, so they have a basic idea of what their blood pressure runs, so they can tell you. They can tell you if they have any issues that keep their blood pressure elevated or decreased. Also, you want to make sure that the person, uh, when they sit down to have their vitals taken, make sure that you wait at least 5 minutes. That way their body becomes rested and you get a better reading. Pulse. Now, your pulse is the number of times your heart beats per minute. Pulse rates vary from person to person. Your pulse is lower when you're at rest and increases when you exercise because more oxygen-rich blood is needed for the body when you exercise. So, you're getting more in there. Now, normal pulse rate for a healthy adult at rest is from 60 to 80 beats per minute. Women tend to have a higher pulse rate than men, and we have ways to measure the pulse. You can uh, measure the pulse by firmly but gently pressing the first and second fingertips against certain points of the body. You have your radial pulse, which is right here. You have your carotid, which is about right here. The most commonly used are the neck and the wrist, but you can measure the bends of the arms and the groin, behind the knee, inside the ankles, and the top of the feet, or even at the temple area of the face. Then counting the number of heartbeats over a period of 60 seconds. Excuse me. A faster than normal pulse can indicate problems such as an infection, dehydration, stress, anxiety, thyroid disorder, shock, anemia, and possibly some certain heart conditions. A lower than average pulse may also be a sign of heart condition. So, some medications like beta blockers and digoxin can slow the pulse down. A lower heart rate is also common for people who get a lot of exercise or are athletes. If you check your pulse and your pulse rate should not be routinely less than 60 beats per minute. The beats should also be equally spaced, not excessively strong, which would indicate that your heart is working harder, and no beat should be missed. And now, having said that, sometimes people's pulses skip a beat, sometimes double beats, things like that happen. Respiratory rate. A person's respiratory rate is the number of breaths you take per minute. Now, the normal rate for an adult is 12 to 20 beats or breaths per minute. A respiration for under 12 or over 25 beats per minute while resting is considered abnormal. Among conditions that change the normal respiratory rate, asthma, anxiety, pneumonia, congestive heart failure, lung disease, the use of narcotics, drug overdose. So, we have to take into a lot of take in a lot of conditions when we're doing these, so that we have to ask the patient all these questions, and then we can narrow it down, whether it's a normal blood rate or not. And then, of course, the doctor's going to talk to them and say, your blood pressure is up a little bit. Maybe it's a new doctor. Do you normally have increased blood pressure? Then you can explain to the doctor, no, I have, normally this is my blood pressure, but lately I've been under a lot of stress, or, something like that. Now, I want to talk a little bit more about the blood pressure and how we obtain, and some of the stuff that goes along with it. We know that to obtain an accurate blood pressure reading, we're going to need a stethoscope, a blood pressure cuff, and a sphygmomanometer. Now, having said that, that's kind of old school. Normally, you have the blood pressure cuff in the doctor's offices and digital. So, and some doctors will require you to use the sphygmomanometer and the blood pressure cuff. So, it depends on where you're working. Just be sure that the patient's relaxed and the cuff's not more than 20% wider than the diameter of the patient's limb, like here, their arm, and long enough to make a complete circle around it. If the patient's obese, you might have to use a thigh cuff on their arm. Now, if possible, take the blood pressure in two positions: supine, or seated, and standing. So you can have them lying supine, or have them seated, or seated and or standing. Wrap the cuff around the arm so that it's about 1 inch above the end of the elbow. And palpate the brachial artery. Use your fingers. Palpate, touch, press. And place the diaphragm of the stethoscope over the artery. Below it, but not underneath the cuff. Now, inflate the cuff 30 to 40 degrees millimeter mercury above the point at which the last sound is heard. Release the pressure slowly. Observe the pressure readings on the manometer and relate the sounds heard through the stethoscope. Now, the systolic is the point where the last tapping sound is heard, and the diastolic is the point where the sound disappears. So take the peripheral pulses with the patient in the supine position using your index and middle finger. Palpate the apical, radial, dorsal pedalis, dorsalis pedis. Sometimes these words get your tongue tied. And the posterior tibial pulses. You can palpate all of those. The posterior tibial pulse is palpable behind and below the protuberance of the inside of the ankle. Now, when you're listening to the heart, there's several heart sounds that can be heard by oscillation or auscultation. Uh, the first sounds, heart sounds produced by the closure of the valves of the heart. The first sound, or S1, occurs when the ventricles have been sufficiently filled and the right and left atrioventricular or AV valves close. Uh, the S1 is heard as, or first sound is heard as uh, a dull, low-pitched sound. Now, after the ventricles empty the blood into the aorta and the pulmonary arteries, the semilunar valves close, producing the second heart sound, or S2 as we'll call it. The second heart sound it's shorter, has a higher pitch than the first. The two sounds occur within 1 second or less, depending on the heart rate. Systole is the period in which the ventricles are contracted. It begins with the first heart sound and ends with the second heart sound. Diastole is the period in which the ventricles are at rest or relaxed. Uh, Normally, no sounds are heard during this period. The two heart sounds are audible anywhere in the region over the heart, but the best place to hear it are over specific valve areas. Uh, Rhythm is the pattern of the heartbeats and the intervals between the beats. It may be regular or irregular. Normally, equal time elapses between the heartbeats. Any deviation from the normal pattern, we call that arrhythmia. Murmurs are produced by turbulent blood flow and may occur in any cardiac auscultation site. So this is the volume of blood flow, the force of the contraction, and the degree of the valve compromise. All contribute to murmur quality. Now, you might want to know what murmur is, so let's give you some kind of descriptive terms to give it character. Murmurs are those whooshing sounds. Although the mitral sound is usually the loudest, you can also have a stenotic mitral valve that moves very little and may produce a muffled sound. So all of these things are considered. I hope you've enjoyed the course so far. Uh, Learning what you write, or not necessarily learning what you've already learned, but reinforcing what you've learned so that you'll be able to get out and take the exam and go to work and work really hard in your chosen career. I look forward to your post this week, and please, please, please post on time. It is imperative that you post on time. If you don't post on time, then I have to send you emails, texts, call you. Why did you not post on time? If you're going to have an issue and not going to be able to post on time, let me know. I mean, I'm not an ogre, as you uh, know. I will allow you to catch up. So I look forward to seeing your posts and reading them, and have a great week.